Hi, I'm Hali Mallard, a nurse practitioner student with South University, and I'm going to be performing a head-to-toe assessment. Okay, I'm washing my hands. I'm going to place some gloves on here. Hey, can you tell me your name, please?
Josh Mallard.
Okay, and your date of birth?
March 3rd, 1984.
Okay, can you tell me where you are?
Tifton, Georgia.
Okay, the patient is alert and oriented. All right, so we took your vital signs previously. Your blood pressure was 128/72, heart rate is 67, respiratory rate was 16, temp was 98.2. So those are all normal. I see that you've lost 25 pounds since your last visit, which is good. Current weight is 248. Your height is 6 foot 2 inches, so that makes your BMI around 38. So it looks like you're headed in the right direction. All right, so now I'm going to begin my exam, if that's okay with you. All right, I'm looking at the patient's skin now. I'm feeling it. It is warm to the touch. It is dry. There are no signs of trauma or lesions, no abnormal bruising at this time. I'm going to begin by palpating your head. At any point, if you feel tenderness, you let me know, okay? Any tenderness?
Nope.
Okay. And your hair is balding slightly, but it otherwise appears to be normal. Okay, we are going to palpate your temporal pulses. Left is 2+. Okay, right is 2+. All right, I'm going to palpate your jaw. This is going to check your trigeminal nerve. Any tenderness there?
Nope.
Okay, open your mouth against my resistance. Good, okay. Open your eyes wide for me. Raise your brows. Smile. Puff out your cheeks. All right, all of that appears to be symmetrical as well. Okay, we're going to do a little test at this point. I want you to close your eyes for me. You're going to feel me touching your skin. I need you to tell me if you feel soft or hard.
Soft. 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 Hard. Soft. 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 Hard.
Okay, good job. Did all of that feel equal on each side, or did one side ever feel unequal? Okay.
Same.
All right, good deal. Okay, prior to him coming into the exam room, we used our Snellen chart here. He did have 20/20 vision in each eye. All right, so we're gonna do check your peripheral vision at this time. I'd like for you to cover your right eye with your right hand and look straight at me. Whenever you use the confrontation test, wiggle fingers. Whenever you see my fingers, I want you to tell me, okay?
Mm-hmm. Mm-hmm.
Okay. All right, and now do the same with your left eye.
Uh-huh. Yep. Yep.
All right, so that's good. Peripheral vision is good also. All right, this time we're going to check cranial nerve 3, 4, and 6. It's your oculomotor nerve, your trochlear nerve, and your abducens nerve. Look straight at my nose. Follow my finger with only your eyes, okay? All right. All eye movements were symmetric. There was no nystagmus noted, which is also good. Okay, now we are going to, I'm going to use a light to shine in your eyes. It might be a little bright. I'm checking your pupils and the response that they have to the light, okay? Cover that up for me. Perfect. Pupils were equal and reactive to light on that side. And equal and round and reactive to light on the right side as well. All right, patient's conjunctiva is pink and moist. There's no scleral icterus noted. No abnormalities with his eyes noted at this time. Okay, if I had an ophthalmoscope, I would use it to check for red light reflex also. But I don't have that with me at the moment. We're going to inspect the ears. Looking at him straight ahead, his ears are symmetrical. There's no redness or swelling noted on the outside. I'm going to palpate them. You let me know if you feel any tenderness at any point. All right. Okay. I'm going to have you cover your right ear. I'm going to whisper some words into your left ear. This is checking your acoustic nerve, which is cranial nerve number 8.
1, 2, 3.
Okay, and now do the same with the other one.
4, 5, 6.
Perfect. Cranial nerve number 8 seems to be intact. All right, we're going to check, do another little hearing test here. It's going to check for sensorineural or conduction hearing loss. So what I want you to do is I'm going to place this on this bone right here behind your ear and then also in front of your ear. You need to tell me when you stop hearing the sound and where you hear it best at, okay?
Can't hear anything. I hear that.
And then when it goes away.
Can't hear anymore.
Okay, where did you hear it best at?
In front of the ear.
Okay. Same thing on this side.
Nothing. Nothing.
Can you hear it on that side?
Nope.
Let's try it one more time.
Nothing. Hear it.
Okay, so you heard it best in front of the ear.
Yes. Front of the ear.
Okay, now we're going to do the same thing. I'm going to hold it right here on top of your head. You tell me if you hear it equally on both ears, okay?
I hear it.
So it seems to be evenly distributed.
Mm-hmm.
All right. So there doesn't seem to be any kind of hearing loss. We're going to take a look at the internal portion of your ear to see if you have any abnormalities there. We're going to be looking at the tympanic membrane, looking for any cerumen buildup or any redness, exudate, anything like that. All right. I can get it turned on. All right. Got quite a bit of cerumen buildup there in that ear. Even more in that ear. Do you have any difficulties hearing in that ear? No?
No.
It's kind of hard to visualize his tympanic membrane on this side because he has so much cerumen buildup. So we may need to discuss this impacting that. Alright, so otherwise his ears look great. Now we're going to check out your nose. I'm going to look at it. Like I said, his nose is symmetrical. Doesn't appear to have any deviations on the, looking at it externally. I'm going to take a look at the inside to look at his internal nares. Okay, once again, his mucosa is pink and moist. There are no patency issues on the internal nares either. Alright, so we're going to palpate your sinuses around your nose and up on your forehead area. You tell me if you have any tenderness, okay? You have any runny nose or anything like that lately? No?
No.
Okay. Alright, good job. Didn't seem to have any issues with his sinuses. His, like I said, his nares are patent, and his mucosa is pink and moist. Okay, smile for me. I'm going to take a look at your teeth. Patient has good dentition. Don't see any issues with hyperplasia of his gums. Okay, now we're going to use a tongue depressor here to take a look at his pharynx. Alright. Did you have your tonsils removed?
Yes.
Okay, can't visualize the tonsils, of course. Uvula was midline. There was no issues with swallowing either. So cranial nerve 9 and 10, glossopharyngeal and vagus seem to be intact as well. There was no exudate noted, no redness noted. Like I said, his tonsils are missing. Stick out your tongue for me. Okay, that is symmetrical. So hypoglossal cranial nerve number 12 is also intact. All right, we're going to do some neck testing now. I want you to flex your neck this way. Okay, extend it back for me. Okay, move it to the left, to your right. Now rotate it for me. Okay, no range of motion issues there. All right, we're going to palpate your lymph nodes at this time. Okay, preauricular, postauricular, occipital, submental, submandibular, superior cervical, posterior cervical, supraclavicular. There were no enlarged nodes noted there either. All right, so now we're going to palpate your thyroid gland. And for this test, I have to kind of get behind you, so I need you to stay right there where you are. Okay. Located the patient's Adam's apple. I'm going to move down just a hair. All right. Swallow for me. Okay. And again. Okay. No enlargements there. No asymmetry noted on that palpation either. Okay. Looking at your shoulders. His shoulders, there's no deviations. They are symmetrical. Can you raise your arm for me? I'm just going to palpate your axillary nodes. Make sure you don't have any enlargements. The central portion. Any tenderness there when I palpate? No? Okay, pectoral. Any tenderness there? Okay, let's do this side also. Any tenderness on this side? Okay, not feeling any enlargements in the axillary, central, or pectoral on this one. Okay, like I said, his shoulders look great. As I touch your shoulders, do you have any kind of tenderness as I palpate them?
Nope.
Okay, I want you to shrug your shoulders against my resistance. We're going to check cranial nerve 11, your spinal accessory nerve. Perfect. All right, let's do some range of motion test. Raise your arms up for me. All right, and up like this. Okay, and in front. All right, is any tenderness? Feeling kind of restrictions there. All right, so now we're going to palpate the elbows, epitrochlear nodes. Any tenderness? Okay, bend your arm like this for me. Any tenderness there? Out. Okay, all right, let's do the other side. I'm going to palpate. Not feeling any abnormalities. No edema. Any tenderness? Okay, now out. And out. All right, back in. All right, did you feel any kind of tenderness there? All right, now we're gonna check your pulses. We're gonna check your brachial pulse and your radial pulse on both sides, okay? Okay, brachial pulse is 2+, which means we know his systolic is at least 60. Radial pulse is also 2+, which would generally indicate at least a systolic of 90. Okay, 2+ on the left side. All right, 2+ on the radial on that side too. Both sides were symmetrical to each other. Okay, looking at the patient's chest, chest appears to be atraumatic. It is symmetrical. There are no abnormalities. Trachea is midline. AP diameter is normal. I'm going to now, at this time, I'm going to auscultate his carotid arteries and also listen to his heart sounds and then his lung sounds also. All right, so sit up straight for me. Okay, take a deep breath and hold it. No bruits noted on the carotid arteries. All right, now we're going to listen to the heart sounds. This is aortic. Pulmonic. Tricuspid. Mitral. that the PMI is on the left side, the midclavicular line. Now we're gonna, there on his heart sounds, I'm sorry, there were no murmurs, no gallops, no rubs noted. Do you have any kind of history of any cardiac problems? No. Okay, perfect. Now we're gonna listen to your anterior lung sounds. You can breathe normally. Okay, lung sounds are equal on both sides. There were no sounds of adventitious breath sound, no signs of adventitious breath sounds, no rhonchi, no wheezing, no rails or anything like that, no crackles. So those were clear and equal. Now we're going to do some things on the back of your chest. Okay, I want you to say 99 for me.
99, 99, 99, 99.
Good. Okay, so that's looking for tactile fremitus, looking for any lung consolidation, but there were no abnormalities noted then. Now I'm going to listen to his posterior lung sounds. Okay, deep breath. And again. And again. And again. One more time on this side. One more time on this side. Okay. Once again, the lung sounds were clear and equal bilaterally, posteriorly. No signs of adventitious breath sounds. While I have him sitting up, I'm going to check for any CVH and tenderness also. If you feel any tenderness as I'm palpating, let me know. No?
No.
On this side? No? Okay. So no tenderness on palpation. Okay, now we are going to lie back. I'm going to take a look at your abdomen. We're going to listen to your abdomen also. Okay, looking at his abdomen, there's no striae, no bruising, no abnormal coloring. We're going to listen to his bowel sounds at this time in all 4 quadrants. Typically, you would listen for a minute, at least a minute in each quadrant. Okay, bowel sounds are active in all 4 quadrants. Now I'm going to auscultate his arteries in his abdomen. It'll be the aortic, the renal, the iliac, and the femoral, listening for any bruits or abnormalities. Okay, aortic. Renal, so on each side of the umbilicus. Iliac. And femoral. Perfect. No bruits or other abnormalities noted. I'll auscultating those arteries. Now I'm going to do palpation of his abdomen, of his abdomen. Or actually, I'm going to percuss first. This time we're percussing at the liver's edge, moving over to the spleen. I can also palpate right here to see if I feel any masses in where the abdominal aorta is, but like I said, there's no pulsatile movement, no masses noted in his abdominal aorta. Okay, we're going to do some palpation of his abdomen. I'm going to do some light palpation. If at any point you feel tenderness, please let me know. A little ticklish. Okay, going to palpate the liver's edge. Deep palpation, bear with me. Okay. Now, whenever I press and let go, any tenderness there? Okay, so negative Murphy sign. I think I saw that you had your gallbladder removed, is that correct? Okay, so no gallbladder. I'm going to palpate the spleen's edge. Okay, sorry, I know you're ticklish. Okay, any tenderness there?
No.
All right, so gonna do some tests for appendicitis. I want you to lift this leg up for me. Just raise it straight up. Okay, any tenderness in your abdomen there? Okay, now do the other leg. All right, so negative so sign. All right, now we're gonna bend this leg up, flex it. We're gonna rotate it inward. Any pain in your abdomen? All right, so negative obturator sign, which are both signs of both tests for appendicitis. All right, so next what we're going to do is we're going to take a look at your, one other thing in the abdomen. Let me palpate your bladder. Any tenderness there? Don't feel any masses or distension in the bladder either. And like I said earlier, he was negative for CVA tenderness, so I think that his GU exam is negative. Okay, now looking at his hips, I'm going to do some palpation of your hips. You let me know if you have any tenderness. No edema, no ecchymosis noted within his hips. Okay, now we're going to try to check your range of motion with your hips. I want you to raise that leg up as high as you can. Yep, there you go, sorry. Okay, good. Now we're going to abduct it out to the right. Okay, now adduct it back in. All right, and you can go rotate it around for me. See if you can kind of rotate it like it. Good, very good. No range of motion issues on the right side. Do the same with the left. Up. Okay, out. We're going to abduct it back in, and let's rotate it. All right, perfect. Okay, flex this knee for me. All right, we're going to palpate it. Let me know if you have any tenderness. Okay, so to look for any ACL injury, you would typically perform an anterior drawer maneuver. You can sit on the patient's foot, pull out, see if there's any abnormalities there, which there's not. Let's do the same for this one. Flex it. Palpating any tenderness. Okay, anterior drawer maneuver. Pulling out. No abnormalities there. All right, so now let's, and you bent your knees. There were no issues with flexion in your knees. Looking at your feet. No ecchymosis in your feet. No edema in your ankles either. I'm going to palpate your pulses. Pedal pulse is 2+. Dorsalis pedis is 2+. Popliteal 2+. And posterior tibial 2+. We're going to do the same thing on this side. This foot, any tenderness on palpation? No wounds noted. Patient is not a diabetic. No edema noted to the ankles. Any tenderness when I palpate? No? Okay. I'm going to do your pulses on your feet also. Pedal pulse is 2+. Dorsalis pedis 2+. Popliteal 2+. And dorsalis pedis 2+. Okay, so flex your feet up towards you. Okay, and down, like you're pushing the gas. Now do it against my resistance. And again. All right, perfect. I want you to take this foot and slide it from your knee down. Very good. And now the other side. Okay. Any issues there? Okay, that was symmetrical. Didn't see any abnormalities. I'm going to check your sensation on your lower extremities just as we did earlier. You let me know if they feel equal on each side, okay?
Okay.
Can you feel me touching you?
Mm-hmm.
Okay. And now?
Mm-hmm.
Okay. Was it soft or was it sharp?
Felt soft.
Did it feel equal on both sides?
Yes.
Okay, we're going to do it again.
Hard. Hard.
Equal on both sides?
Yes.
Alright, perfect. Okay, the patient has full strength in his lower extremities. There were no issues when performing the strength exercises. Okay, so sit up for me. We're going to check your reflexes. Alright, so first we're going to check your brachial reflex, your bicep reflex. Okay, now hold your arm up like we did earlier. This is checking your triceps reflex. Okay, brachial radialis, sorry. Okay, sorry. Okay, biceps, good, okay. Alright, triceps, good. Brachial radialis, good, okay. Patellar, perfect. Perfect, okay. Equal on both sides. Achilles reflex. Okay. And now we're going to check your favorite. All right. Ticklish. Okay, so now we are going to do some rapid movements just to check make sure that you can do rapid alternating movements. It's a neuro exam. I want you to hold your left hand out in front of you, and I want you to pronate and yep. Very good. All right, and again with the other side. All right, those movements are symmetrical. It doesn't seem to be having any issues. I want you to tap your right foot on the floor as quickly as you can. Perfect. Okay, and now again with the left foot. Good deal. All right, stand up for me. Let's make sure that we're in view of the camera. All right, I want you to bend over with your hips in place. It's checking spinal range of motion. All right, and now back. Okay, now laterally, go to the left side. Perfect. Now to the right side. Any tenderness there?
Nope.
Okay, now I want you to rotate. All right, those movements were symmetrical as well. There was no range of motion issues with his spine. All right, a couple more tests and then we're done. I want you to stand right here where I am and walk towards the other end of the bed. All right, that gait was equal, it was steady. Come back heel to toe for me. All right, that was also equal, no issues. All right, stand in front of the camera. I want you to close your eyes, feet closer together. Hold your arms out in front of you. We're doing looking for pronator drift, doing the Romberg's test. There's no drift noted. Patient doesn't appear to be swaying, so he's had a good neuro exam too, a negative exam. All right, thank you. This concludes our assessment.